Okay, my friend, let's work on a two-part video today. We want to work on lengthening and strengthening the psoas muscle, this one that likes to pull on the back, and then we want to strengthen the opposition, get these glute muscles firing so they can do a better job of helping out our core muscles to do what they're supposed to do to keep our back nice and safe. Let's begin. Number one, let's go for a deep release with the softball. I want you to put this an inch below your belly button and an inch to the right. And I want you to bring it down to your elbows. So if we're on the right side, I want you to bend this left knee over to the side. And what we're doing is we're trying to relax into this pressure and give yourself a little bit of time to kind of search around. So that inch below and an inch to the right is not specifically exactly where that psoas is. You can search around and find out what parts of that tension hurts the most. We want to do this for a minute or two. And since this psoas muscle has 5 attachments to 5 of our lumbar vertebrae going down towards our leg, that muscle is as wide as your hand. So there's lots of fibers in there to get after. So you can move it down, you can move it up, you can move it side to side, you can move it diagonal down towards that iliac crest towards the outside and back up towards that belly button. And I want you to find whatever hurts. You can keep it moving, you can go up and down, you can go side to side, you can go diagonal, or if you find a spot that's really painful, you can just hang out there. And I want you just to ease into it, try and get that pressure to calm down. Some of you might notice that this is really painful. And it might even feel gastric. There might be some pain in there just because there's a lot of pressure and build up in your digestive system. So don't get too crazy with it if that pain is extreme. Just do what you can do and see if you can tolerate it. So I want you to do that for 2 minutes on the right side, and then I want you to switch it over to the left side and do another 2 minutes. This muscle is big. You got to give it some time. See if you can get that muscle to respond to the pressure. And when you get off of it, you might even feel quite a bit of pain as you're getting back off of it, and then it should go back away. And I want you to spend time working on releasing that. So that's number one, deep release. Step two, we want to stretch that psoas out. So the first one, after the softball release, I want you to get into a nice lunging position here. I'm here by the wall so I can hang on. If you can grab yourself a chair or a couch so that you can hang on to it, that'd be advised. And then I want you to lunge into it, so you're stretching this left leg back, and I want you to raise this left arm up. And what we're doing is we're trying to create this nice long tension from here down towards the hip through your arm and your lat. And I want you to lunge forward, lean back, and then with your left arm up, I want you to lean towards the right side. And we're trying to open up the space in your stomach here. And I want you to take a deep breath, breathe it out, lunge a little bit deeper. And then go again, deep breath, breathe it out, lunge deeper, third time, lunge deeper, and I want you to lean back a little more to the right, and I want you to hold that for 20 seconds. Taking nice deep breaths. If you get any cramping in your muscles, back it back out, let that cramp release, then go back after it again. But holding that for a good 20 seconds, let that elongation happen. With each breath, we're expanding the rib cage. We're getting that diaphragm to expand. And then go ahead and bring it back out. Good. I want you to repeat this 3 times on each side. So between each rep, I want you to switch. So if your left leg is forward, your right leg is back. It's actually easier if you flip around this way. So that way, as you lunge into it, you can hang on to the wall or the couch. Again, bring that right arm up. Right leg back. Right leg back. So lunge forward, right leg back, right arm up. Want you to lean back, lean to the left, deep breath. Exhale, lunge. Again, deep breath. Exhale, lunge. Deep breath. And lean to the left, lean back, hold for 20, deep breaths. Good. Come on out of that slowly. So again, I want you to release slowly, get a breather in between, and then switch back and forth. I want you to do that 3 times on each leg. So that's part 2. Next thing we want to do to elongate the psoas and get a nice stretch into it is I want you to lay on your belly, get into a press-up position or upward dog or cobra. So you're going to put your hands beside you, and I want you to push up, and I want you to start mild. I want you to start by just going up. Make sure there's no pinching in your low back as you do this. If that pinch is mild, I want you to continue through it. If that pain begins to increase, get more medium pressure or more severe pressure, don't go into it. Don't push so hard. So I want you to go where you're comfortable. Try and get into that press up position, going up. You're trying to keep your hips on the floor. And as you get to the top, I want you to do a little exhale. Push into it, and then back down. I want you to rep out 10 of these, going up, and back down. And the reason that we're doing these repetitively and not holding it in a sustained position is we're trying to get some wiggle in those joints. We're trying to return motion to those joints that have been stuck for so long, and we want to get fluid moving as well. So if we have any bulging discs going on, then we're trying to push that fluid back towards the center and get that pressure off the low back. Good. And that should, at the end, start to feel like you're stretching in the low back and maybe even into those stomach muscles and hopefully into that psoas. Get some of that motion going through the anterior portion and the posterior portion of the spine. Good. Part 3, strengthening. Many of you will have really tight hamstrings, so sitting in a long sit position like this with your legs out straight, not doable. So what I want you to do is I want you to bring one leg to the side if that's too tight. If your hamstrings allow, try and go into a long sit position. But I'll show you first with your leg here. What I want you to do is I want you to actually hang on to this leg, pull yourself forward so you're trying to get your back nice and straight. And I want you to sit up nice and tall. And I want you to try and lift that opposite leg, straight-legged, off the ground, up and down. What we're trying not to do and we try to avoid is rounding this back out. Try and keep up in an upright position. If that's too hard, go ahead and bring that knee into this position. Hang on where you need to, and you're just trying to lift that knee up and down. But if you're feeling comfortable, confident with those long hamstrings, I want you to sit, put those hands behind you, help you keep that straight position. I want you to do as many lifts as you can through that psoas, through those hip flexor muscles. Trying to get some movement off the ground there. Do as many as you can. Rest. Switch the other leg. Do as many as you can. Doesn't matter if you have your toe pointed or if you have your toe pulling back towards you. Either way is fine. Try not to round the back out. Sit up tall. Switch back to the other leg. I want you to do 3 sets of these until you're really tired. Great job. Next strengthening exercise we're going to do, you can either use a kettlebell if you have small enough feet, or if the kettlebell's handle is big enough, you can hook that foot through that kettlebell, but this one's kind of too small, so I prefer an ankle weight, and you just tighten up that ankle weight so it fits around your foot pretty snugly. So standing up nice, straight, and tall. If you need to hang onto the wall, that's fine. Suck in your belly button. I want you to raise that up like this. Notice that this leg is staying straight. Most people, if they have really tight hip flexors and they have tight hamstrings, as they get that up, they want to bend this knee to try and get it higher. There's no reason to try and get it higher. Just do what you're confident and comfortable doing with that motion. Go to fatigue on one side, then switch to the other side. Again, trying to keep this posted leg, stability, leg nice and straight. Hang on to the wall if you need the balance. Good. I want you to do 3 sets to fatigue, both sides. Okay, last exercise for strengthening the psoas or the core muscles to assist the psoas. I want you to lay on your back. And what I want you to do is I want you to rest your head down. I want you to suck in your belly button. So put a finger in your belly button, suck in your tummy, and you're just trying to get core contraction all the way around. Not necessarily trying to flatten your back, just trying to get core contraction to support your core. And then what I want you to do is I want you to bring both these legs up, keep your back flat-ish, suck in your belly button, and I want you to do tiny knee circles. So I just want you to do one direction. Just keep it nice and tight. Keep that belly button sucked in. Try not to push upward with those core muscles. Keep it sucked in towards the floor, towards your spine. I want you to do one direction circles until you're nice and tired, and then I want you to rest. I want you to do that until you're fatigued, and I want you to switch and do the other side. So bring it back up, suck in the belly button, circles the other way. And these knee circles should be strengthening your core muscle going all the way around, as well as your rectus abdominis or your six-pack muscle. And that six-pack muscle should be learning how to work with the true core muscles and helping the psoas muscle realize that, oh, it's control of the movement of these legs. And so it's not trying to be a core muscle in this instance, it's trying to let those other two muscles do their job. Good job. And rest. So those are your 3 exercises I want you to do for your core to strengthen it up and your hip flexors, and see if that'll help out. Next, let's switch over to the glutes and lengthen those and strengthen them up. Grab a ball, tennis ball, softball, baseball, whatever works for you. I like a lacrosse ball the best, but I have a softball on hand. So sitting on the floor, I want you to just put that underneath one side. So we're putting it on the left side to begin with. I want you to raise your body up and then let that knee tip over like that. That gives you lots of surface area to look for whatever is tight. So you can either keep that leg up, halfway over, or all the way down, but you're just looking for whatever hurts. Leg straight works fine too. You can even kind of rock back and forth by pumping that ankle. There you go. Ankle back and forth to give you some rocking motion, or just use your hands. And you don't have to keep the motion going. You can if you want to, if you're trying to get some cross friction against those muscles, or back and forth, circles. We're just trying to get some good circulation going. And if you find a spot that, ooh, it just hurts so good, just hold it still, take some nice deep breaths. Ease into it. What we're trying to do is we're just trying to bring your brain's attention to the tension that you're holding in those glutes. And when it can recognize that that's not a great position for it to be in, your brain is going to work actively to try and get that to release. So holding that, giving it a chance for it to just resonate with your brain and say, whew, I've been tight for too long, let's make this change happen. And then if that releases, find the next spot. Innately, you might even know that, oh, if I go this direction, it's going to hurt pretty good. I want you to follow that. Just find a place that's manageable. So 4 out of 10 pain, you're usually making faces. 6 out of 10 pain, you're breathing pretty good out of it and trying to get it to move. And that's about as high as you want the pain to go. If you can't hardly stand it, that's probably a little too much. Find an area that you can tolerate. So go there for 1 to 2 minutes. Then swap sides. Do the other glute. Again, lifting up onto there, letting that leg fall over, straightening it out. Either keep it moving, side to side, circles, whatever you can to kind of loosen that up, get some blood flow in there, break up any little adhesions or rehydrate that fascia, whatever you can do to make those glutes feel a little bit happier. So fight the pain with some pain, and it's totally worth it in the end. All right, step 2 for the glutes. Let's do some stretches. So I want you to cross your foot over your knee. Some of you might be too tight. If you want to start out with a straight leg and just can get it onto that shin, up to the knee, that's great. Otherwise, bring it clear up. I want you to lean into that knee and then lean forward. I also want you with the other hand to grab underneath your heel and pull up as you're pushing down like that. And as you lean forward, that should just initiate a really good, nice, long stretch there. Breathe. As you take breaths, breathing it out, you're tricking your brain. So what we're trying to do is we're trying to do anything that we can so we can get a little bit deeper into the stretch, and your brain puts up these guards. So what you can do is as you exhale, you're tricking your brain into going a little bit further and letting down its guard so you can get a really nice, good elongation out of that stretch. So good job there. Now what I want you to do is do the opposite. I want you to pull up and lean forward and try and pull your opposite shoulder towards that knee. And again, you're trying to lean forward and pull up at the same time and breathe. And holding that stretch, putting it on length, you're getting past those guarding responses, giving it a nice, good chance to lengthen out. So I like to do 3 of those breaths, and then you do a nice long hold for 10, 20, 30 seconds, whatever feels good for you. And then go switch the opposite side. Again, pushing down on the knee, grabbing underneath the heel, pulling up, leaning forward, pushing that down, and breathe. Good. If this is giving you a pinching sensation in the front of that hip, just do what you can do. Don't try and push too hard into it. Just do what's tolerated. Holding that for a nice 10 to 20 to 30 seconds as tolerated. Then bring it up. Pull that knee towards your opposite shoulder. Lean into it. Lean forward. That should be on length. Good, and hold. And you can do this as many times as you want. These glutes can kind of handle a lot of abuse. There's a lot of fibers in there. They are pretty tight. They need a lot of time for you to spend. So you can do this at work. You can do this if you're sitting at church. Just try and get that motion back into those glutes. Good. All right, stretch number 2. Sometimes we need to work on hip internal rotation to help those glutes. And so what I want you to do is I want you to lay on your back. And I want you to, hard to see, I want you to put your foot is where your knee is, and then walk it over to the side, and then let it fall inward. And it might not fall in very far. It might even be able to touch all the way to the ground. And so a lot of times I'll grab something, whether it's a blanket in your bed or a weight that you can add onto it. I want you to put that weight on there to help pull that leg down and in. So a lot of times when people are beginning, they're probably going to start about this high. But see if you can drop it down and just lay comfortable there. And so what we're trying to do is get this hip internal rotation to stretch out. Some of those glute muscles do internal and external rotation. But this should kind of help loosen up that joint so they can go either direction and have the motion that you really want out of it. So just lying there. Notice that your other foot might be trying to tip outward. So I want you to maybe lift your bum, try and tip the straight leg inward with your foot. And just lying there, letting it go. A lot of times you're guarding against it, trying to push back up against gravity or against that weight. Take some breaths again. Those cleansing breaths can sometimes help calm your mind and say, this is okay. We are doing this on purpose. There's a reason for it, and yes, it's safe. So I want you to hold that for about a minute or so. Hopefully it'll start easing up and letting it tip in a little bit further and further. This is a really easy one to do if you're just lying in your bed, because the weight of that blanket can really help just to keep that in the right position. The one, half pound to 1 pound of a blanket can just add just enough pressure to help that slowly creep in. And if you do this every night, maybe a little bit in the morning time as you're waking up, that can really get some of that motion where you want it to go. Good. And switch to the other side. I'm going to do it this angle so that it's a little bit different. So I want you to again bend that knee so that your foot is beside the other knee. Walk it out so that it's the same level, and then just letting it tip in. And then adding your weight as needed. You can start on your elbows. You can go all the way flat, but just work on that hip internal rotation there. Again, same thing. Deep breaths, breathing through it, letting it drop in, holding that for a minute or two. All right, strengthening those glutes. So I want you to find a ball. Foam roller works actually pretty good. I want you to put that between your knees and lay onto your back so you can do some bridges. So you can put your hands beside you, wherever you want to. I want you to squeeze that foam roller as hard as you can, or that ball. You can use a volleyball, basketball, whatever feels good. Squeeze that, raise those hips up, and I want you to go further. Raise them higher. Good. Take a deep breath. Squeeze the foam roll. Go higher. Good. Holding this for 10 seconds. bridging up. I want you to really focus on, are you squeezing together? Because what we're trying to do is we're trying to retrain those adductors to work with the glutes. So adductors meaning your groin muscles there and your glutes working together in harmony, so it's not trying to pull your pelvis out of alignment. And rest. Good. Another thing to focus on before you even go up, so squeeze that foam roller, flatten your back first, and then rise up, and so your core is activated too. And then I want you to get a deep breath, squeeze, go higher. Get a deep breath, squeeze higher. Squeeze higher, and then back down. Good. Rest, give it a time to calm those muscles down before you go for another round. So I want you to do 3 of those for 10 seconds. So squeeze, flatten your back, going up. Good, and rest. So I want you to do 3 sets of those. So 3 times 3 times 10 seconds for 3 sets. So you're going to be doing 9 of them. But what we're really trying to do is we're just trying to reconnect how those groin muscles work, because they're balancing you as you're standing, whether you're on 2 feet or as you're walking and you're 1 foot to 1 foot. We need those muscles to work in conjunction with each other so they can work in harmony and not start pulling your pelvis out of alignment, which can really affect your back. Okay, next strengthening exercise. See if you can find yourself a band. If you don't have a band, that's okay. But the band is just going to add a little bit of extra resistance, so that makes it harder. So laying on your side, and most people think about side planks as doing feet straight out. We're going to start with our knees bent because it's a good beginning position, and you'll see why in a second. So post up your arm underneath your shoulder. I want you to suck in your tummy. I want you to raise those hips in the air. But as you go up, you're going to notice that your hips want to kind of angle back because that's where you're strongest using these hip flexors. We're trying to get these glutes. So push those hips forward, and I want you to raise that top leg in the air. Push those hips forward, squeeze those shoulder blades, hold 10 seconds. So the idea here is that we're doing stability with the bottom leg. We're doing some resistance against gravity against the band with the top leg, and then squeeze those shoulder blades, get the upper back involved, and then back down. So good. Deep breath. Go ahead and go again. Suck in your tummy. Rise up on your elbow knees. Push those hips forward. Rise that leg in the air. Hold 10 seconds. Push the hips forward. Suck in your belly button. Squeeze your shoulder blades. Good. And back down. Good. And one more time. Suck in your belly button. Rise up. Bring that leg in the air. Push those hips forward. Squeeze those shoulder blades together. Hold that. Good. And down. Good. First set. Second set. Flip to the other side. Shoulder on top of elbow. Hand on your hip. Suck in your belly button. Rise up. Raise the leg. Push those hips forward. Squeeze those shoulder blades back. Hold, resist against gravity. This is not a hard band, by the way, and it's hard enough of an exercise. Should be shaking a little bit. And back down. Good. Suck in the belly button, go up, leg up, hips forward, shoulders back, hold. If you want to make it a little bit harder, always bring that arm up in the air. Move it around. Keep that leg up, hips forward, shoulders back, and rest. Good. Notice that this is challenging. This is hard enough with your knees bent. You don't need to go all the way out into the straight leg for beginners. And one more time, going up, leg up, hips forward, shoulders back. You can put that arm wherever you want to. And rest. Good. Good job. I want you to repeat that 3 times on each side. So go until you're nice and fatigued. Okay, last exercise for strengthening these glutes. I want you down on all fours. And what I want you to focus on is you're trying to flatten that back. So not arching like a cat-cow here. We're trying to get here. Suck in that belly button. That should be flattening out your back. Then I want you to slowly start extending that leg. And as you extend, I want you to also try and drop it down towards the floor a little bit. Keep that belly button sucked in, and see if you can go just a little bit higher. That should be activating your hamstring as you're trying to raise up. It should be feeling like it's trying to resist that core and try not to arch that low back. Hold for 10 seconds. We're just trying to lengthen that out and then back down. Good. Suck in the belly button again. Slowly extend the other leg. Drop that hip towards the floor. Suck in the belly button. Try and go a little bit higher. Holding that for 10 seconds. If you need to, try and turn that toe inward just a little bit, using those inner hamstrings. And switch again. Suck in the belly button. Flatten that back. Extending out. Drop that hip. Straighten the leg a little bit higher. Suck in the core. Turn that toe inward just a little bit. Holding for 10. And switch. Suck in the core. Stretch that leg out. Drop that hip towards the floor a little bit. Go a little higher. Keep the core tight. Turn that toe inward. Hold. And rest. Good. I want you to do 10 of those. So 5 on each side. Take a break. Then I want you to go again and do a second set of those. So that's your last strengthening exercise for these glutes. You're trying to retrain the core, how it's supposed to work appropriately with these glutes, trying to suck in everything, get these glutes to fire so that they can propel you forward, do great squats, great lunges, and also just standing positions. So hope that helps. Hope that that is a way you can get those muscles lengthened and strengthened and cooperating better. So great job, guys.